You know, if I can digress for just a second, last night I was on television. I was on the telephone with a person at an emergency hospital ward in Pennsylvania because a good friend had called and he had rushed his significant other to the emergency room because this woman was having trouble breathing, had a high fever, and could not really catch her breath. And they got her into the hospital, but the waiting room was so crowded, things were so backed up, they couldn't even get her to be seen initially. So because I knew this person, I called the desk, the receiving nurse, and asked what the situation was. And has anyone even, and by the way, I wasn't complaining because they're getting the living hell kicked out of them, by the way. Doctors and nurses, some of them are just, they're running dry. I really mean it. They're getting the living hell kicked out of them, and sometimes physically. And to make a long story short, it took a while because the vast majority of the emergency rooms and the docs were occupied taking care of COVID patients. I bet every one of you can name somebody who got sent to the hospital with something other than COVID and couldn't get it taken care of. How many people do you know, I know, who've had to put off elective surgery they need done, but they couldn't get a hospital room. Didn't mean they were going to die in many cases, but some places in the world that's happening. You can't even get to do the elective surgery that's necessary, particularly for a lot of cancer patients. So look, things are changing, and we can end this. We can end this thing. It's easy, it's accessible, and it's free to get the vaccine.